So, like, what is the cause of this burping?
So, but the biggest culprit is the back. The gas is the air you have swallowed yourself.
Okay. Why do people or we feel sleepy? हमें नींद आती है एक अच्छा heavy meal के बाद.
The blood flow goes to the intestine.
So, if I give you five random foods and you have to rate on a scale of 1 to 5. Number 1, biryani.
Out of all of them is fuchka. There's no doubt about it.
Detox diets. Lot of coaches like 1,000 rupees, 1,500 rupees for a detox diet chart that promises transformation in 2 महीने में 10 kg कम.
Look, there's no diet, there's no fluid which is typical detox drink, detox diet. There's nothing called that.
तो अगर वेट लॉस करना ही चाहता है कि अपने घर पे, what should be the starting point?
Well, the starting point is eating slow.
There are certain type of people who will eat 2 plates of biryani, have a heavy meal, but they still remain skinny throughout their life.
Well, it is largely genetics, I tell you.
गर्म पानी लेमन के साथ अर्ली मॉर्निंग, हेल्थ एडवाइस और ओवरहाइप्ड ट्रेंड.
Overhyped, but nothing bad.
A very well marketed product that we have, apple cider vinegar.
More of a marketing gimmick and a big fad.
One practice जो हमें स्टार्ट करना चाहिए, जस्ट वन सिंपल प्रैक्टिस यहाँ से स्टार्ट पॉइंट होगा हमारा.
Have one full glass of water and decide that you are going to chew your food well.
Namaskar. We welcome you to another episode of the Inspired Podcast. And today on the show, we have a person who doesn't need any further introduction. We have Dr. Udipta Ray. Welcome to the show, sir.
Namaskar.
So, Dr. Udipta Ray is here with us. And today, he's not going to talk on symptoms. He's not going to talk on surgeries. Rather, he is here as a friend who is going to guide us on how we can live a better life. And in simple words, it is going to be tummy ki baat. So, sir, let's get the conversation started.
Thank you, Abhishek. It's great to be here in this show with your viewers around.
Thank you, sir. So, my question to you will be, बिरयानी भी खाना है, थम्स अप भी पीना है, और बात हो रही है तो इसके बीच में म्यूजिकल बैकग्राउंड भी देना है. तो सर, दैट ब्रिंग्स मी टू अ क्वेश्चन टू स्टार्ट ऑफ. लाइक इन्होंने जैसे भी बर्पिंग किया और बंगाली में बोलते हैं ढेकुर. सो लाइक व्हाट इज द कॉज ऑफ दिस बर्पिंग?
So, what happens in burping is that stomach lets out the excess gas that is accumulated inside by relaxing the junction between the esophagus, that is the food pipe, and the stomach. So, the gas which has built up comes out and it produces a noise. So, that is burping. It is like a release mechanism. It is like a check valve which opens up and lets the excess gas out.
Okay.
So, what happens? How this gas builds up? That must be your question, right?
Yes.
So, basically, whenever you're eating, drinking, chewing, maybe a chewing gum even, you are swelling some air every time.
Okay.
And people who are anxious, nervous, they tend to subconsciously swallow more air. So, this is medically known as aerophagy.
Okay.
This is the biggest cause of having so much of gas inside your stomach. And another cause is having fizzy drinks, you know. So the
It's
so-called
like
cold drinks.
he had biryani with thumbs up. The potent
That
drink.
is a wonderful combination to have burps, you know. It's no wonder he's having so much of burps. But another important cause is having some food which is notorious for producing more of gas, largely due to bacterial activity and all. Like beans produce a lot of gas. So, like cabbages produce a lot of gas inside your tummy due to bacterial activity. So, but the biggest culprit is the gas is the air you have swallowed yourself.
Okay.
That is what comes up as burps.
So this combination, I'm just sticking to biryani for some more time since it can be given as the regional most preferred food in Bengal. So biryani and coke or biryani with thumbs up, the deadly combination. जब हम इसको हेल्थ के हिसाब से देखते हैं, हाउ हेल्दी इज दिस बिरयानी एंड थम्स अप?
Well, as you have said, rightly said, it is a deadly combo. But people often have it. You know what happens? Biryani is something which is very rich in oil, carbs, and difficult to digest food, which slows down digestion. And this food is retained in the stomach for a very long time. It distends the stomach quite a lot. So, with this distension of the stomach already existent, if you have a fizzy drink like the one this fellow had, so what you have a lot of gas inside which is already built up, and you add something more. So the excess one comes out as a burp,
Okay.
giving a false sense of relief. This gives you, well, fine, that it has come out, the burp has happened, so I am
हजम हो गया,
relieved.
खाना हजम हो
So,
गया हमारा.
but the reverse is true.
Okay.
You have added carbonated drinks which makes the system still slower. And
get.
you have added essentially some fuel to fire.
Okay.
So this is how it happens.
Okay. So I've always like it's my childhood perception. Like in जब हम छोटे होते हैं तो we have multiple perception. I always thought कि burping और ढेकुर is the elder brother. इसका एक छोटा भाई है which is हिचकी. वो इधर तक आता है, वो निकलता नहीं है, वो अंदर ही रह जाता है. So हिचकी कैसे कॉज होता है? What causes हिचकी? Is it like somebody अभी छोटा है, बड़ा होगा तो बर्प होगा?
नहीं, ऐसा बात नहीं है. Hechki is very different, you know. Hechki, there is a spasm of the muscle in between your tummy and chest.
अच्छा.
This muscle which separates the tummy and chest is known as diaphragm. So there is a spasm contraction of the diaphragm, and your vocal cord also snaps close. So you have a particular sound. So this is essentially a response to something which is irritating this muscle,
Got it.
or some other nerves which are essentially the controlling factors like phrenic nerve, vagus nerves. There's an important nerves which get irritated, and this is a reflex which happens as I should say a marker of this irritation.
Okay.
The body gets this reflex, and your body is trying to overcome this irritation.
समझा. अच्छा, वो तो चला गया सर. सर इट्स एन आइडियल थिंग आई हैव सीन पीपल हैविंग हैवी मील्स, जैसे अभी इन्होंने बिरयानी और थम्स अप दे दिया, अब उसके बाद इनको नींद आ जाता है. वाई डू पीपल और वी फील स्लीपी? हमें नींद आती है एक अच्छा हैवी मील के बाद.
A very interesting question. So basically, when you have a very heavy meal, for example,
हाँ.
the body is trying to absorb. So all the energy, all these activities, including blood flow, goes to your tummy.
अच्छा.
So the intestine gets the attention because all your energy should be diverted in producing more of absorption of nutrients. खाना पचने में जो एनर्जी जाता है ना, वो एनर्जी के कमी से तुमको नींद आ रही.
Okay.
So the energy goes to the intestine. The blood flow goes to the intestine. This is one. Second is that if you take a meal, there the sugar spikes up. Okay. So with the sugar, the body tries to release its own insulin to combat this sugar spike. They need to digest the sugar as well. And often this insulin production overshoots what the sugar levels have shot to.
Okay.
So basically the body insulin production goes slightly higher so that the sugars dip down. The sugar consumed is more. So there is a lack of sugar. So basically there is some brain activity which is suppressed.
अच्छा.
So you have some sleepiness. And there is another theory also. It's not a theory, there is another mechanism that with this insulin spikes, what happens? This insulin, it promotes some amino acids
Mm-hmm.
to enter inside the brain,
Acha.
and these amino acids produce some metabolites, including happy hormones. You feel good after good
Haan,
food,
absolutely.
and together with this, some hormones like melatonin. You must have heard of it. It's a sleep hormone. It's very common these days to speak about sleep and sleep hormones. So this production also goes up.
Mm-hmm.
So you feel bit sleepy. So these are all factors which point towards the fact that after a heavy meal, feeling sleepy is something a natural reaction of the body,
Okay.
nothing unusual.
Okay, sir. So, sir, also apart from biryani, Kolkata has multiple street foods and popular ones, right? So, if I give you five random foods and you need to ascertain us, help us ascertain कि उसमें से सबसे जो ज़्यादा हेल्थ पे इफेक्ट डालता है, that has to be placed at number one,
You mean the worst one?
the worst one at number one, and
So
as compared to
why should the worst come first?
no, I'll give you five items,
Okay.
and then you have to rate on a scale of 1 to 5. 1 being the worst. Okay.
Okay.
So five items. Number one, biryani.
Okay, one.
Biryani one.
One.
Okay, great. Second is fuchka.
5.
5. Koviraji.
2.
Okay. Mutton kosha with luchi.
5.
No, there can be 1 5 only.
Okay. So 2, sorry, I rated Kobiraji as 2. It should come to around 2. Okay. I'll settle for 3.
Mutton koviraji is 3. Right?
Right.
And the last one is definitely the most Shorsho Ilish.
So I'm left with very little option.
Yeah,
So,
that's 4.
okay.
Now with all the options, now you know the options. इसके हिसाब से अब आपको रेट अगर करना होगा, then how would you go about it? Let's start with the least जो सबसे कम हेल्थ पे इफेक्ट करता है. So at number 5 हम क्या प्लेस करेंगे?
So the best food you mean to say, okay?
In the lot.
In the lot, if you are asking to give me an opinion about, first you have spoken about biryani, second Kobiraji cutlet, third you have spoken about fuchka, fourth luchi with kosha mangsho,
Yes.
and fifth ilish,
Sorche
sorche ilish. So this is your list. The best out of all of them is fuchka. There's no doubt about it.
So वो हमारे हेल्थ पे कम इम्पैक्ट लाता है.
That is the best food for you to digest. I give you
Okay.
the reasons. So basically, if you can ensure that the water quality of fuchka is good, suppose the water quality is good, then what are you giving as fuchka? So basically, you are giving some a water which has some tamarind, some lemon juices, some dhane pata, and some pudina pata.
Yes.
Okay. So this is about the water. So this water has a mild acidic property. So this initiates some secretion of digestive juices. You have dhane pata and pudina pata, which are soft to intestine.
Okay.
They soothe the stomach. And there is water. So basically, you are hydrating the system.
And what about that papri?
Fillers. Okay.
The papri.
Okay.
Because most of the puchka people, what we have seen, they use soybean oil, which is again injurious to health.
Right. Absolutely. Even a deep fried papri is the worst component of the fuchka. If you ask me about all the components, it is the worst component of fuchka. So it's better to have fresh oil, usually a light oil fried, or maybe baked fuchka, or the kind of fuchka you make at home, you know. So basically, that is something which will ensure that the oil quality is not recycled oil. So This is the worst component of fuchka because it contains flour, or maybe atta at most, because it is reddish in color, so it should be atta. So that is a better variant of maida. So it's better to have atta rather than maida. Okay. And another good component of fuchka is what you are adding inside it. So it's a mix of chola, chanas. So basically you have some potato. So light food, carbs with a bit of protein component in chanas. So the protein component although is very low, but still it is easily digestible stuff.
Means
So you have a
we are
combo of digestion stimulant, water, easily digestible stuff, and with okay fine, less evil of having a
so permissible.
yes.
कुछ का खा सकते हैं हम
Yes.
कभी कभी.
Nutritionally speaking, out of this list,
Fuchka
this is the
safest.
best option to have.
Okay. Now, what about biryani? You already told us.
Right.
Kosha, manshu, and luchi.
Yes, nothing less harmful. It is equally as bad as biryani that way. If you look at biryani, it has carbs, it has oil, and you have refined carbohydrate, and you have a heavily marinated, heavily cooked with a lot of spices, mutton or chicken, whatever. So essentially, it remains the same.
Same.
If you look at both the things, the only thing is that you have more of spices in biryani and you have no spices in luchi.
Luchi.
Otherwise, the refined carbohydrate component remains the same.
Okay.
The oil is almost the same. The other component is almost the same. So there's not much of difference in between. So if you place them side by side, they are equally bad for gut health.
Okay.
But of course, you cannot resist them at times.
Absolutely. Kobi Raji.
Well, this is where where it's slightly different. You have a package of protein here, and that too, it is not totally deep fried, but of course, you have a batter which is deep fried. So here it is slightly better in one sense. It is slightly better because you have a lot of protein, which is lean protein, and you have less of other components. You have less of oil, less of the batter, so less of carbs.
Got it.
So slightly higher on protein, less on carbohydrate. So it is slightly better, edge better than the other two.
Now coming to the big show. Sorso Ilish.
Sure, shale is right. Wonderful. So you have a lot of spices, you have oil, but you have the benefit of fish. So you have the benefit of fish protein, and you have the benefit of omega-3 fatty acids. And Ilish Mach, as you must be knowing, is one of the richest sources of omega-3 fatty acids. So it is a much better food compared to the other. So I would rate it immediately after fuchka if it comes as
Number 4.
number 4.
Got it. One more question that a lot of my friends, especially my like Marwari friends, since they don't consume non-veg, so they always complain this that there are certain type of people who will eat 2 plates of biryani, have a heavy meal, but they still remain skinny throughout their life. And then there is a segment of the people who will follow all the diet and they think एक समोसा खा लेंगे ना तो 2 kg बढ़ जाएगा. So what is this difference? Like why is this इतना दोनों में difference क्यों कि एक खा रहा है तो मोटा नहीं हो रहा है और एक हल्का सा भी अगर आलू खा लिया कुछ खा लिया he becomes fat.
Well, it is largely genetics, I tell you.
Okay.
Because it is proven that some genes are obesity resistant.
Okay.
So these are the genes which can readily process food into more calorie conversion rather than storage. So these are also the genes which initiate some extra activity, and there are some genes which remarkably process foods good into calorie. So with the help of these genes, you can really fight obesity very well. Secondly, many of these people whom you see to eat a lot on in public gatherings may be spending a lot of calories in other activities. Like they may be the people who are moving around all the time. They are rather standing rather than sitting all day.
Yeah.
So they prefer to stand, they prefer to move around. So they come to spend a lot of calories.
Okay.
So that way, you can find that they are the people who are utilizing food well, storing less, spending more. So they may be compensating their extra meals by eating less
Acha.
at other times of the day, eating less over the entire week.
Got it.
So that way they average out. So they get over their dietary habits of consuming a lot. Maybe নেমন্তন্ন বাড়িতে অনেকখানি খাবার খেলো এইরকম রোগা.
Right, right.
So you find that person is blessed. Well, he may be having some extra talent to spend.
Yes,
He may be
yes.
going the extra way to spend the extra calories. So you have to give some credit to him as well. So not everything goes on genetics.
Right.
And you know, eating a lot of food and still remaining thin can be due to some diseased elements as well.
Okay.
So you eat a lot, but you do not digest. Maybe you are having some enzymes which are deficient. So you eat a lot and you poop out a lot.
Yes.
So it goes down the drain. Or you eat a lot and your body is all there to eat up all the food. Suppose you have some diseases of thyroid hormones excess, which utilizes food and converts into calories. So meaning that your metabolic rate is higher. So utilize that food well. So basically you eat a lot and you can handle it well. It is well spent.
Well spent.
So don't gather. So there are many factors, you know. It's all about, in common parlance, what we say, that your bank balance grows when your income is well above your expenditure. So basically you put on weight essentially when there is a caloric imbalance between intake and expenditure.
That's well explained, sir. Yeah. So, which brings me to two different questions. Question number one, I've seen people, they don't eat much, but they have a bloated tummy. They may appear thin, not muscular, thin, skinny arms, skinny legs, but they have a bloated tummy. That's one. Second case is, I have known people who will have their lunch and within 2 minutes they rush to the washroom. So, what are these two cases? ये कैसे होता है कि एक तो है कि 2 रोटी खा रहे but they have a big tummy and the whole body is skinny. Second is somebody जिसने अभी lunch किया 2 मिनट के बाद they will have to go to the restroom. कंट्रोल भी नहीं होता है. तो ये दो केसेस क्या है?
So first is you have a big tummy and skinny legs and hands. So this is a sign of ill health.
Okay.
Your tummy may be big not only due to bloating, it may be due to some diseases. For example, a chronic liver disease will produce some accumulation of fluid
Okay.
inside your tummy,
Sure.
make it big, while your hands and feet are all lanky, thin because you have severe muscle wasting. So this is one. Secondly, you can have really a very loose and lax muscles of your tummy. It all bulges out. It can be bulging of the tummy, which appears due to muscle weakness. Of course, it can be due to excess gas, but your the other clue is that you have your arms and legs all skinny, means that you have some muscle wasting.
Mm-hmm.
So that is a sign of ill health.
Ill health. Got it.
And your second question is rushing to the toilet immediately after meals. Did I get it right?
Yes.
So if we break it down, it is an exaggeration of a normal reflex. So this is known as a gastrocolic reflex.
Okay.
What happens when you eat, your stomach distends, there are some hormones which are secreted, some nerves which are stimulated, which initiate some activity in the colon. So, by which your stool is pushed down by the colon, because the colon also starts emptying itself up and prepare for the food you have digested.
Acha.
So, you have taken in the food cannot travel down your intestine so fast. It is impossible for the food to come out. But what happens when you take the food inside the stomach, the reflex activity produces emptying the colon.
Okay.
So that the colon is preparing itself to accommodate the new stuff that is coming in.
Got it.
So this is known as a gastrocolic reflex. But this gastrocolic reflex may be heightened. Heightened in situations like IBS, as you know, irritable bowel syndrome. It can be heightened in people who are very anxious. Okay. It can be heightened by certain food stuff in susceptible people. Suppose you have a gluten sensitivity or you have a lactose intolerance. You take something of wheat or something of milk. Suddenly there is a distension and you start having this heightened reflex and you rush to the loo. So it can be heightened in certain conditions. Otherwise, it is largely an exaggerated normal reflex.
Got it. Right. So coming back to Bengali food, right? So in Bengal we have this culture कि हमारा जो meal होता है that is incomplete without a sweet in the end. So is it healthy? Non-healthy? मतलब खाने के बाद मिठाई तो चाहिए.
Well, if it is not a lot, I would call it quite healthy.
एक मिठाई, एक संदेश खाने के बाद.
Okay. Granted. Granted.
There you have it.
Granted.
Great.
So, provided you have your blood sugar well controlled. If you are diabetic,
No.
stay away from it. So, if you otherwise healthy, go ahead. It is not going to do all that harm. But if you have an option, think of things which are going to have less spikes of sugar. Maybe some curd, doi is a better option. A neutral test of doi. Maybe doi with nolen gur, complex carbohydrate, which is not going to give you a sugar hike like that.
And when you are saying doi, it's not mishti doi, it's the white curd that we get.
White curd, especially. So if you have some white curd with maybe some extra added gur, that is the best thing to have. So, but such combinations are started appearing. You know, gur doi has also come into Bengali recipes.
Yes. I remember when I was pretty small, like we usually don't have that memory of like being a 2-year-old or 3-year-old. But at that time, when we used to have weddings, वहाँ पे क्या होता था? At the end, people were served with doi, sada doi, and bundia, and that was the final dessert or something like that. So was it a healthy one? And even a lot of people today want to have that. मेरे को बूंदिया चाहिए और सादा दही चाहिए.
That is a wonderful thing to have that way. As far as your palate is concerned, there are two contrasting shades of taste. You have bit of sweet on one hand and the sour on the other hand. Talk our mishti, dutoi pavo.
Yes.
ঠিক আছে? But when the sweet component is very little, and the other component is substantially better, definitely it makes a better choice.
Better choice. Okay. Now let's move on to a very specific section. I absolutely love this section because it helps me understand इंटरनेट और रियलिटी में क्या डिफरेंस है. ठीक है. सो आई हैव अ कपल ऑफ क्वेश्चंस फ्रॉम माय एंड दैट आई विल आस्क यू एंड दैट इज देयर ऑन द इंटरनेट. यू हैव टू टेल मी एक लाइन में वेदर इज इट अ गुड प्रैक्टिस और इट्स एन एब्सर्ड थिंग दैट्स पुट ऑन द इंटरनेट. ठीक है. नंबर 1 इज गर्म पानी लेमन के साथ अर्ली मॉर्निंग, हेल्थ एडवाइस और ओवर हाइप्ड ट्रेंड.
Overhype, but nothing bad. This is not unhealthy, but definitely overhyped.
सो पीपल से कि सुबह उठ के गर्म पानी में नींबू गार के पी लो और टमी का फैट कम हो जाएगा, डिटॉक्स हो जाएगा, ब्ला ब्ला ब्ला.
Well, you cannot help detox in that sense. So you have wonderful organs like kidney, like your liver, who are performing detox 24 into 7.
अच्छा.
So just to maintain that they function well, you maintain hydration. So that is the beauty of having maybe a 250 ml of glass of water, lukewarm water with nimbu.
नींबू.
So the additional benefit of nimbu is that it is a mild organic acid. So it comes with some vitamin C, maybe something to the tune of 10 to 15% of your daily requirement of vitamin C, but still it gives you some vitamin C. It gives you some stimulus to secretion of acids in the stomach and some digestive juices as well. And it helps in absorption of certain components like iron, calcium, and it gives you some extra citrate, citric acid, that is the main component in nimbu. That is a protection against stones in the kidney.
Okay.
Because calcium binds and gets excreted in the kidney, and citric acid helps in dissolving this calcium, So nimbu in water has some health benefits, but definitely it was overhyped. If you are taking it off before every meal, well, fine, then you are probably trying to increase the volume and trying to replace some component of my meal by taking a glass full of water.
No,
Otherwise,
early morning.
one shot in the morning doesn't do anything to do with weight reduction.
Got it.
It will marginally decrease the breakfast you are having. But that comes at a cost. You have to make sure that you wash your mouth very well. Otherwise, you'll have erosion of your teeth.
Oh.
This vitamin C that is acidic is going to erode the enamel of your teeth.
कोई कोई इन्फ्लुएंसर तो बोलते हैं कि सुबह सुबह उठ के खाली पेट में ऐसे पी जाओ, बट दे डोंट मेंशन कि ब्रश करो कि नहीं करो.
You have to know there are two things. You have to wash your mouth well and make sure that you do not brush within 30 to 45 minutes. Otherwise, your enamel will get eroded more because it is already made soft by the organic acid of nimbu.
That's important. Yeah.
So you cannot brush immediately after taking that.
Got it.
So you have to put your teeth to rest and wash your mouth well.
Got it. Second in the list is detox diets. A lot of coaches like 1,000 rupees, 1,500 rupees for a detox diet chart that promises transformation in 2 महीने में 10 kg कम, magical detox diet. So how, like ये फंडा जो detox diet का है, is it that good? So few years ago I heard about this keto diet. People starving themselves to death almost. खाना ही नहीं है कुछ, बस एक ये खा लेंगे हो जाएगा, and then it vanished somewhere. So like what's your take on those detox diet?
Look, there's no diet, there's no fluid which is typical detox drink, detox diet. There's nothing called that. So you have detox organs which are constantly functioning inside you. You can help them. You can help them to pertaining to diets which do not put a lot of pressure on digestion. So you do not take a lot of things which the liver will find it difficult to metabolize. So you do not put on something which is going to slow down your metabolism, slow down your stomach, intestine,
Got it.
everything. So you think of having some fiber, having some portion of fruits, well balanced vegetable, lot of protein, because Indians are deficient on protein most of the
Yes.
time. I tell you, Indians are protein deficient most of the time. Even for non-vegetarian people in the greater part of India, it is found that they do not consume all protein which they should be consuming otherwise. So-called non-vegetarian people, leave aside the vegetarians, most of whom happen to be protein deficient.
Protein deficient.
Because there is a wrong concept that dal, katori
Dal.
of dal is good enough to support the protein. Well, fine, if you look at dal, I'm not blaming it as such, but it is 75% carbohydrate and only 25% protein. Almost 3 is to 1. So you are taking more of carbs rather taking a lot of protein. Rather depend on whey protein, which gives you much more protein, and that too good quality protein when it comes to vegetarian diet.
Next in the list is a very well marketed product that we have, apple cider vinegar. कुछ बॉटल में बेचते हैं, कोई फिश टैबलेट में बेचता है, but they all sell it and sell it at good profit margins. So how effective is this? कोई काम आता है apple cider vinegar?
Yes, they have been put to test when it comes to weight loss. There is a modest decrease in weight. There is a very little change in cholesterol and triglyceride with consumption of apple cider vinegar. But essentially, if you look at what exactly is apple cider vinegar, vinegar is acetic acid. So, how is it made when it comes to apples? Apples are fermented to produce alcohol, and this further is processed by bacteria to produce, and human beings to produce acetic acid. So when it comes from apples, we call it apple cider vinegar.
Okay.
Essentially, it's a weak organic acid. So it will have the similar benefits of vitamin C, Nimbu with water.
Water.
So the benefits are almost similar, minus vitamin C component. So it stimulates GI secretions, but of course it comes with a caution that you have excess of acids, you will have problems with stomach. So at the same time, in addition to Nimbu water, leave aside the good quality of Nimbu water. If you take a lot of apple cider vinegar, it can interestingly decrease potassium. So it can have adverse effects.
Okay.
So that is a flip side of having a lot of apple cider vinegar. So more of a big fad, I should say. More of a marketing gimmick and a big fad.
तो सर आपने तो इंटरनेट में जो भी अवेलेबल है वेट लॉस के लिए, ठीक है, लेमन वाटर लो, डिटॉक्स डाइट करो, एप्पल साइडर विनेगर लो, प्रोबायोटिक्स लो, आपने सबको रिजेक्ट कर दिया. तो अगर वेट लॉस करना ही चाहता है कि अपने घर पे, व्हाट शुड बी द स्टार्टिंग पॉइंट?
I have not rejected probiotics, mind it. I have not rejected probiotics. Well, the starting point is eating slow. First thing, and having water before meals. Okay. So the first thing in the morning, you have saturate yourself with water. Decreases the craving for food to start with. In fact, having water before meals will also make your stomach bit full. So you'll reach your satiety early, even with less meals. And the moment you start chewing your meals well, you start activating your GI system. Because the first point of contact is your mouth.
Yes.
and the first enzyme starts secreting from the salivary glands. So this is the beginning point for the GI system. Leave aside the smell. The beginning point is taste.
Taste.
So you start your activity from the mouth itself. Now lower down. When you think of losing weight, you have to watch out your diet well. Take everything in moderation. Make sure that you have less carbs. Make sure that you have less harmful carbs. Make sure that you have adequate protein. Make sure that you have adequate hydration. Make sure that you munch every couple of hours rather than having a lot of big food at the end of the day.
Correct.
That will lead to more accumulation of fat. And above all, do some regular exercise. At least walking for 45 minutes, brisk walking for 45 minutes a day. So if you follow this, I tell you, you'll start losing weight, or at least you can check your weight gain. So this is the starting point of your weight loss journey.
Rather than being dependent on tablets and
Right.
fitness mantras.
And they come with their own side effects as well.
Yes.
All those slimming tablets, all those slimming agents, all slimming drugs come with their own package of side effects. So you have to choose with caution, if at all, and not yourself. Let the doctor make a choice whether at all you need to take on these. But the decision should come only after a trial of a good healthy diet and exercise schedule.
Okay. So basically the first step is not to panic and be dependent on external sources. Start at home. Start with
at
your
home.
basic diet.
Right. So do not take on these sleeping medicines without medical advice. So think of rescheduling your diet. Think of reorganizing your diet. Think of spacing your meals well. Think of having good exercise. So that is the first learning lesson of a weight loss journey.
So viewers को ये भी बताना चाहूँगा कि sir was the only proctor in robotic GI surgery till recent, means by till 2025 sir was the only person or only proctor in robotic GI surgery. Okay, sir, now coming to the robotic surgery, I'll tell you a very interesting thing. Nowadays we see all hospitals और हेल्थ केयर इंस्टीट्यूशंस वो लोग ना मार्केट कर रहे हैं कि हमारे पास रोबोट है रोबोट है रोबोट है. सो आई हैव दिस हैबिट ऑफ यू नो ऑफ हैविंग इवनिंग टी. तो मैं ऑफिस से निकल के शाम को एक चाय की टपरी पे गया एंड आई सॉ कपल ऑफ ओल्ड पीपल डिस्कसिंग दिस कि आजकल तो रोबोट आ गया है. तो दो आई नो द कॉन्सेप्ट, आई वॉज क्यूरियस कि क्या समझते हैं. सो आई टोल्ड देम कि दादा ये रोबोटिक सर्जरी जो हो गया है तो अब तो सर्जन नहीं करता है ना. And I was amazed to find that like না ওরা করে না, ও রোবটে সব ফিক্স করে দেয় প্রোগ্রাম করে দেয়, রোবট নিজে নিজে সার্জারি করে. तो आई टोल्ड हिम कि ऐसे तो नहीं हो सकता बिकॉज अगर कुछ गड़बड़ हो गया तो हु विल डू. एंड दैट वन ऑफ दोज पीपल वो मेरे को बता रहा है तुम्हें टेस्ला देखो छो. आई सेड नहीं कोलकाता में तो नहीं है, आई हैवंट सीन टेस्ला. तो बोलता है सुने छे तो टेस्ला गाड़ी ऑटोमेटिक ड्राइवर. हम ना हाँ आई हर्ड अबाउट दिस. इज लाइक सेम टेक्नोलॉजी. तो फॉर आवर व्यूअर्स एक बार आप बता दीजिए सर कि रोबोटिक सर्जरी में कैसे होता है कि मतलब आप लोग ऐसे कॉन्फ़िगर करके बैठ गए एंड देन आप लोग साइड में जाके ऐसे चाय वाय पी रहे हैं एंड देन सर्जरी हो रहा है क्या खुद से?
No, robot has nothing to do by itself. It's just a better device. So whatever surgery happens is something that the surgeon does. The robot translates the movements of the surgeon. So basically it's a more refined device, like laparoscopic, getting more refined. How is it refined? Because it comes with better vision, 3D vision, magnification. Surgeons' hands can tremble, but robotic arms do not have tremor. They don't tremble. And you have the precision, which is laser guided. So basically so much of precision. And you can have instruments which can move in all directions, you know. You cannot move your hands beyond a certain angle,
हाँ.
backwards or sideways.
Mm-hmm.
But robotic instruments can move in all directions. So, what happens? Suppose I'm sitting here, I'm moving my hands, fingers, and finger slots. And looking at the screen, I'm seeing it 3D.
Mm-hmm.
So, there beside me is the patient on the operating table, and the robotic arms are inserted inside the patient.
Okay.
So, I'm connected with a cable in between, and whatever movements my fingers are doing
Mm-hmm.
is exactly the movements which are being done by the instruments inside the patient.
Okay.
So the robot has nothing to do by itself. It is I who is doing all the movements, all the procedure, and the robotic instruments are just executing the movements with a lot of precision, tremor filtration, and a lot of a range of movements. And in addition to it, there is technology of the robot which makes it totally painless.
Mm-hmm.
So you have precision, vision, tremor filtration, painless outcome. So everything translates to better outcome of surgery. But I tell you, robot is just a dumb device. It has no AI. It cannot do anything by itself. In fact, we call it master-slave relationship. So whatever commands I give is exactly whatever movements the robot performs.
Got it. Okay. Now, coming to the AI part. So, AI is now the new talk of the town. So, everything that we touch has become AI enabled, right? So, when it comes to your specialty, right? So, I have seen a lot of interviews where surgeons are saying that they use AI to find cancers. Now, coming to your domain of pancreatic cancer and colon cancer, हम एआई का क्या डेवलपमेंट देखे, लाइक इज इट पॉसिबल कि इज इट लाइक हम लोग उसको पहले से डायग्नोसिस कर सकते हैं यूजिंग एआई?
Uh, it is possible to diagnose and interpret images very well. Suppose you have images from CT scan. So AI can be used to interpret images. AI can be used to come to inferences from different investigation parameters, which can be loaded in the AI matrix. So suppose you have some blood parameters, you have some CT scan pictures, you have colonoscopic findings, and you can put them in the patient profile and load it on the AI platform. So the AI will frame your diagnosis.
Okay.
Whether it is an ulcerative colitis or it is a malignancy with a possibility score. Of course, there is a probability, and it can give you some diagnosis with certain degree of accuracy, not 100%. Even after everything, it's a clinical judgment,
Yes.
the clinical decision making, which takes the final call. But of course, it can help you in many ways to come to diagnosis, to strategize how to go ahead with it. Suppose you have a stage 2 disease of malignancy, and how to go about it. What are the recommendations outright, and how do they pertain to exactly to what you are doing? So this can be something, a decision making which can be promptly generated by AI.
So it's again assisting you.
So basically, again, assisting the clinicians. So AI will, of course, help every doctor in a big way to execute clinical decisions, to implement treatment, but the last word still remains human judgment.
Okay. And when you talk about test and all, so हमारे सोसाइटी में एक कॉमन अगेन परसेप्शन है कि अनलेस द सिम्टम और अनलेस द सफरिंग हाथ से निकल जाए और बर्दाश्त नहीं हो रहा है, देन ओनली दे केयर कि नहीं अब तो डॉक्टर के पास जाना है. एंड दिस इज़ अ कॉमन सोच है सोसाइटी में. नहीं, घर पे कोई अगर दवा मिल जाएगा, रेंटैक या कुछ एक मिल जाए तो हम खा के देख लेते 2 दिन, अगर ठीक नहीं हुआ तो जाते हैं डॉक्टर के पास. एंड बाय द टाइम यू गो टू द डॉक्टर, द अनदर फोबिया इज कि नंबर वन डॉक्टर फीस चार्ज करेंगे, नंबर टू डॉक्टर अननेसेसरी टेस्ट देगा, नंबर थ्री डॉक्टर हो सकता है खुद के कमीशन के लिए मुझे और भी टेस्ट दे दे इसके बाद. बट सर टेल मी समथिंग, you in your career which spans over 25 years you have seen a lot of cases जो पहले आपके पास अगर आ जाते तो they could have been solved like within a couple of months later on when they came and the kind of surgeries they required, right? So जहाँ पे people are thinking कि हम 1-2 हज़ार रुपये अपना बचा ले, वहाँ पे they have incurred 3 से 4 लाख रुपया सर्जरी पे, plus the mental trauma, plus the big hole they make in the pocket and the family stress. So how do you place this? Like when should a person think कि नहीं मेरे को डॉक्टर दिखा लेना चाहिए?
So basically, if a physical discomfort persists for a long time,
Hmm.
suppose something like you're having an indigestion, maybe something like a reflux
Mm-hmm.
for quite some time, maybe for 14 days at a stretch, you would better go to a doctor, not to a roadside shop and ask for some antacids. It is okay to have reflux once or twice. Suppose you have had a weekend party and you ate a lot of food stuff like biryani and coke, what you started with. So you did it and you had reflux. It is okay to have reflux. It's common. It's physiological. It is acceptable, I should say. But suppose you keep having reflux for a very long time, you better go to a doctor. Maybe something which is very treatable, something like a H. pylori infection.
Mm-hmm.
So this is a kind of infection you can have from water,
Mm-hmm.
organisms which reside in the stomach, which promote stomach ulcers, duodenal ulcers, and GERD. So it can be something like a GERD due to H. pylori, which is very treatable. Okay. So you can pick things up. But at the same time, suppose you have weight loss, you have lack of appetite, and suddenly your bowel habits have changed over time. So if these things happen, maybe for a short duration, don't wait. If you have passed black tarry stool or maybe some fresh blood in stool, don't wait. These are the warning signs where you need to rush to the doctor. Don't think that you passed stool just because your body got overheated or you just got dehydrated and you had some bleeding with stool. No, don't come to inferences like this. Let the doctor have a check. It's normal to have blood in stool. Make it simple, one-liner. So let's think that this is the time and you should be going to the doctor. And I tell you a very interesting story. This is something which is very interesting. A middle-aged gentleman had a denture. Okay. So one fine morning he was eating something. With a lot of breakfast, he swallowed his denture.
Okay.
Okay. So it just passed down his food pipe and he thought that it will come out. After 2 or 3 days, it didn't come out. So he went to a doctor. So he got an X-ray done. So it showed the denture was in the stomach. Okay. So the doctor said that it should come out. If it doesn't come out, then we have to reevaluate, get serial X-rays or maybe more investigations. So so far, so good. Went home. This person was relaxed. So he said that it will come out. The doctor has said it will come out.
Only the first part he remembers.
Okay.
कि हो जाएगा खुद पे खुद.
So next part, if it doesn't come out, observe your stools. If it doesn't come out, you have to come back to me. Was totally ignored.
वो erase हो गया.
Now everything was going fine. After some 6 months time, he started having some bloating of abdomen. So he come up that I am not having regular stools. Okay. So this was after 6 months. Did not report then. He went to a pharmacist, had laxatives,
Hmm.
and he was
The
pooping.
common practice
Okay. Yes.
nearby medical shop में जाके दवा
He
लेना.
turned up at 10 months
Okay.
with a lot of pain and very difficult passage of stool and bleeding. So nothing took him to the doctor save and except bleeding. Fortunately, though,
Mm-hmm.
I'm thankful that he came up. So it was very interesting, Abhishek. I tell you, it was the denture which has traveled all the way down to the colon,
अब वहाँ से
and
निकलने
it got stuck there. So it was a very difficult job for any surgeon because we consulted the gastroenterologist, my fellow gastroenterologist put in the scope, but it was so badly stuck inside the colon that it would have meant a lot of injury. Would have colon could have cut through and
Oh my
could have
God.
come out,
Yeah.
and so it was not possible to take it out with the scope. It was all left to us. And for the first time ever, I tell you, I opened the colon and saw the teeth smiling at me. Jokes apart, but this is one of the lessons
Absolutely.
that to tell you that you should not explain everything to your comfort, interpret everything according to your interpretation. Do not get treated by unqualified pharmacists giving you over the counter medicines for months and days. Rather, get in touch with a doctor and
Yeah.
be in touch so that you can get cured.
Absolutely.
Till the point the doctor finds that you are out of danger.
So we are almost at the end of our show. So we have a signature style of ending this show. तो हमेशा I have something for the audience. So tell me, sir, one habit that people practice commonly, ये सोच के कि ये तो एक अच्छा हैबिट हम प्रैक्टिस कर रहे हैं, बट इन रियलिटी इट इज एग्जैक्ट द अपोजिट. जैसे अभी थोड़ी देर पहले उन्होंने किया, बिरयानी खा के थम्स अप पी रहा, हजम हो जाएगा,
Yes,
एंड द
but
पीपल प्रैक्टिस दिस,
yes.
राइट?
So one habit you mean to say, right?
हाँ, कॉमन हैबिट which can be seen like every household पे होता है.
I'm trying to generalize things. How generalized I can be. So basically, yes, what you have said, combining the wrong things, like biryani and cokes, yes, that is one thing, but that is not universal. I would like to say something more universal. Maybe combining citrus fruits and roots together with more things which commonly produce acids. I give you an example. We combine, uh, for example, you combine some lemon juice together with some other card stuff. You combine maybe milk with lemon juice. So basically, you take them one after another. So that is a bad combination. If you are thinking of fruits which are sour, you should not have them with milk products. So basically, that is going to give some precipitate of milk inside. So don't combine sour foods with milk items.
Okay.
Do not combine heavy things which are gut heavy. For example, sweet, a lot of sweets with meat.
Meat, yeah. And
So-
then in terms of our household thing, we had this mutton in afternoon, and uske baad 2 sandesh nolin gurer. So that's a bad
So that
practice.
is a bad way of dealing things,
Okay.
That is a bad way of taking things. So there are a lot of other habits. For example, when it comes to Indian households, there are some cooking habits like people tend to keep the oil they have used. So they have fried some fish the previous day, they keep the oil for the next fish fry. So preserving oils. So basically that leads to a lot of denatured oils and a lot of bad type of fats which accumulate in such oils.
Got it.
So that is bad for for cooking as a medium.
We shouldn't be reusing our
Right. So
kitchen oil.
better have small bit of oil for repeated fries. You discard the oil after this fries. So use oil less. That is a better way of dealing with things. Second is that in Indian household you have a lot of plastics being used. And that is one bad habit that people, every household should get rid of, using hot stuff in plastic bags. You have a plastic container, plastic tiffin box, and you are pouring some hot stuff, maybe chana, hot chana inside it.
So, sir,
So it is warm.
so when we order food online,
Yes,
we
that is a
get this in container?
toxic thing to happen. You get a lot of food delivered in plastic packs.
yeah,
And you'll be
containers.
surprised to know the quality of plastics are very bad in many of them. They're not meant for human use. They should not come in contact with food at all because these plastics get dissolved and get integrated in food.
And कोई तो वो प्लास्टिक में ही खाना डाल के वापस ओवन में
Yes.
रीहीट कर लेते हैं.
So basically, that is one bad habit for the Indian household. And well, fine. Another thing is Indian households often use a combo of cleaners,
हाँ.
So you have some liquid cleaners, you add on some soda. Okay. So what you ignore is that it gives rise to a lot of fumes, which you tend to inhale, which are toxic. So the biggest threat in Indian families is plastic right now.
Plastics.
Right.
So that needs to change.
So that needs to change.
Yep. Okay. Now coming to the final question of this evening, sir, forget about all the practices that people should do. अगर आज से ही हमें अपना गट हेल्थ इम्प्रूव करना है या फिर हेल्दी रिमेन रहना है, वन प्रैक्टिस जो हमें स्टार्ट करना चाहिए, जस्ट वन सिंपल प्रैक्टिस यहाँ से स्टार्ट पॉइंट होगा हमारा.
Get up tomorrow morning, have one full glass of water, and decide that you are going to chew your food well. That's it.
Oh. No medicine, no consultation, no test,
No test.
just like this.
Start your habit from tomorrow morning. Do it for 21 days and you'll enjoy the benefit.
Wow. Thank you. Thank you so much, sir, for your time. It was wonderful speaking to you.
Same
Thank you.
here. And it was a pleasure meeting you and speaking to you,
Thank you, sir.
as it has been always.
Yeah. Thank you, sir.